So today we have Dr. Janin Edelkamp, Chief Scientific Officer at QIMA Monasterium, and Luis Jimenez, Head of Pharma at QIMA Life Sciences. They will present some of our research and testing solutions for preclinical and clinical drug discovery, and also share some of our latest developments in the field. But before that, we are truly honored to welcome our guest speaker, Professor Thierry Passeron, Professor of Dermatology, who will open the webinar with an introduction to vitiligo, providing an overview of major aspects like disease mechanisms, current therapeutic approaches, as well as discussing emerging therapies and key challenges in research and drug discovery. So Dr. Thierry Passeron is a world-renowned dermatologist and professor, head and chair of the Department of Dermatology at Côte d'Azur University in Nice, France, where he leads groundbreaking research in pigmentary disorders, melanoma, alopecia areata, and vitiligo. He has authored over 380 scientific publications and is widely recognized for advancing our understanding of skin pigmentation, photobiology, and targeted therapies. Dr. Passeron also serves as president of the Department of Clinical Research and Innovation at CHU Nice, sits on multiple international advisory boards, and is a sought-after speaker at major dermatology congresses around the world. So thank you for being with us today, Professor Passeron, and the floor is yours.
Thank you very much. Hello, everyone, and I would like to thank QIMA for their invitation. I'm very pleased to talk about vitiligo. I have only 20 minutes, so I will try to focus on the most important point and challenges on the treatment and also the pathophysiology of vitiligo. So here are my disclosures. So you probably all know that vitiligo is an acquired depigmentation of the skin leading to the loss of melanocyte, and this led to depigmented skin and sometimes hair. It's quite frequent, about 0.5 to 2% of population worldwide. Most of vitiligo are non-segmental vitiligo with bilateral symmetrical lesion, as you can see here, but about 10% of cases are segmental vitiligo that usually start during the early infancy, and sometimes after some month or year, people are developing mixed vitiligo, like this young girl with a segmental vitiligo and then a non-segmental vitiligo. Quite interesting, about 80% of cases at the onset before the age of 30, and now it's very well demonstrated that it's clearly an autoimmune disease and the impact on the quality of life, but also stigmatization is very important. So I will try to briefly give an overview of the pathophysiology. First, we know that, of course, vitiligo is developing on a genetic background, and we have many allelic variations that have been demonstrated. And as you can see here, most of them are in the immune system, innate or adaptive. And you can see that many of them are also shared with other autoimmune disorders, such as type 1 diabetes, autoimmune steroiditis, and alopecia areata. And you can see here that some of the genes are, and this allelic variation are shared between pigmentation and melanoma. And in fact, we know now that the allelic variation that predispose to vitiligo are protective against melanoma. So in vitiligo, we know that it's not only the immune system, but we have also intrinsic abnormalities in the skin, and those abnormalities have been demonstrated in the melanocyte, but also keratinocyte and fibroblast. And on top of this, we know that for many years that there are an increased susceptibility to oxidative stress, and we recently demonstrated that there is also an mitochondrial alteration leading to a mitochondrial release, and this leads to the innate activation of the immune system, leading then to the adaptive immunity. And our colleagues from Bordeaux already demonstrated that on top of the loss of melanocytes, some melanocytes are detached. And this is through the loss of E-cadherin by the increase of MMP9, metalloproteinase 9, that clearly decrease the E-cadherin. And you can see those flying melanocytes that are eliminated through the epidermis. And of course, between this genetic background, there is this exposomal stress oxidative, physiological, can be also viruses, and this is activating the innate immunity, and the innate immunity makes the bridge between these exposomal factors and the activation of the adaptive